places in it.
You have to be in it now. Okay, this is speech number 3, and it's over Alzheimer's disease. Does Alzheimer's medicine cure the disease, or does it give the families false hope? Alzheimer's disease is very heartbreaking and is a struggle for not only the person with the disease, but the families and friends of the people who must endure the pain of watching their loved ones slip away. I think Alzheimer's disease is irreversible, and that the medicines that the doctors prescribe only give the families false hope. The disease called Alzheimer's disease is the 6th leading cause of death in the United States, according to the Centers for Disease Control and Prevention. Alzheimer's is accounted for 3.3% of the total deaths in the United States in the year 2013. Between now and 2030, it's estimated that the elderly population will double. The United States Census Bureau estimates the average increase in the elderly to be 2.8% annually. Due to the fact that the number of people aged 65 and over is increasing, and the Alzheimer's Association is projecting people with the disease to double by the year 2050. Finding out what Alzheimer's is and the known causes of the disease is what researchers need to do so they can find a medicine that can cure the disease. But for now, knowing the signs and symptoms as well as the risk factors of Alzheimer's disease will benefit the patients and family members most. This disease is progressive and incurable, and is caused by degeneration and later the death of nerve cells in the brain. A German psychologist, Alois Alzheimer's, is the one who discovered disease while studying the brain of a middle-aged woman in 1906. The reason he chose to study the lady is because she died after several years of suffering with dementia. He realized her symptoms were not the same as any other disease known at that time. He was the first to discover the plaques and tangles that are used to identify the disease after death. Most people think Alzheimer's is the result of normal aging because it typically develops in people over the age of 65. However, the studies showed this not to be true. When autopsies have been performed on Alzheimer's patients, plaques have been found, which they describe as clumps or clusters of dead or dying nerve cells and other cellular debris in the brain. These findings from the autopsies are inconsistent with those of people who were autopsied that simply had dementia. According to the Mayo Clinic, scientists have not yet pinpointed an exact cause for the disease. They believe that over time, the brain is affected by lifestyle and genetics, as well as the effects from our environment. Although they do not know the cause of the disease, Alzheimer's Association has a list of risk factors. Some of the risk factors are genetic. Aging is the number 1 risk factor. But genetics alone have not proven to be directly linked to Alzheimer's. Other risk factors are cardiovascular disease because of the lack of blood supply to the brain. Researchers have found that people with a higher level of education have shown increases between the connections of neurons in the brain. This enables the brain to compensate for the early brain changes of Alzheimer's disease by using alternate routes of neuron-to-neuron communication to complete a cognitive task. People with a higher level of education typically have jobs which indicate that they most likely have a greater income, as well as they have the tendency to keep the brain stimulated more often. The American Psychological Association lists symptoms of disease as memory loss, confusion with time and place, change in personality, problems with words in speaking and writing, the inability to identify people, misplacing things, being unable to think and reason clearly, withdrawal from your family and friends, and problems performing simply daily tasks, just to name a few. Scientists have described 3 stages of Alzheimer's disease. The first is classified as mild and cognitive impairment, which is when the patient does not yet have outward symptoms, but they do have some of the early brain changes which can be detected by brain imaging and other biomarker testing. Patients in the first stage will be classified to have preclinical Alzheimer's disease. The second stage are classified very mild symptoms, but are still able to perform everyday tasks that would be described as having mild cognitive impairment due to Alzheimer's. The third stage is classified as patients whose symptoms have been pronounced and they are unable to carry out everyday tasks. These patients will be called patients with late-stage Alzheimer's, and they would require total care on a daily basis. The rate at which symptoms progress from mild to moderate to severe differs from one person to another. Studies show that people aged 65 and older live an average of 4 to 8 years after they are diagnosed with Alzheimer's disease. However, some have been known to live as long as 20 years. According to the Alzheimer's Association, patients with Alzheimer's disease will spend approximately 40% of their total number of years in the most severe stage of the disease. Most of the time, the patients will be completely dependent upon someone else to care for their entire daily needs. The patient's needs range from needing help with household chores, preparing food, providing transportation, assisting with treatment plans and medicine, dressing and grooming, managing finances and legal issues, and dealing with the behavioral symptoms. This disease is a very burdensome disease. Treatment of the disease includes pharmacological treatment and non-pharmacological therapy. Music therapy and reminiscence therapy are two of the non-pharmacological treatments. But the pharmacological treatments is where doctors prescribe the prescription drugs. Often the drugs are given to the patient that's diagnosed with Alzheimer's disease, and the family feels like it's going to slow or stop the progress. The drugs that are currently being used to treat this disease are Aricept, Namenda, and Exelon, just to name a few. Aricept.com states, it's important to remember that while Aricept treats